That impacts thousands of people in the U.S. And in this week's Medical Moment, we continue our look at brain tumors.
Yeah, a few weeks ago, we looked at the different types of tumors and what they can mean for a patient. Today, Spectrum Health Medical Group gives us a look at some of the treatment options. Brain tumors come in all shapes and sizes, and they affect people in different ways. The great majority of times, once a doctor discovers them, they need to take a closer look.
A needle biopsy to determine what the type of tumor is, or in most cases, we'll go and we'll take the tumor out, because most brain tumors we've found over the last couple of decades that the more tumor we get out surgically, the longer that patient's going to live.
Location of the tumor often dictates how it's removed. This tumor in the pituitary area required something minimally invasive.
As we come in with the endoscope this way, this is the nasal cavity here, which puts us right here in front of the tumor. So we're able to come up with the endoscope, leave the endoscope right there, get in, make a hole right there, and then shell all that tumor out. And once we shell that tumor out, we can actually advance the endoscope into that corridor and look around and see whether or not there's still tumor sitting up there.
If the tumor's at the base of the skull, things can be more difficult.
My longest case was probably 3 different sessions, each close to 18 hours. The technology is getting better, so there are better things to facilitate doing those cases. So many of them don't take that long anymore, but you know, there's still a lot of skull-based cases that may take 12 or 15 hours.
Care is needed because it's the brain. It's where everything originates, but it's also part of the body that can't heal itself.
And that's the one thing that makes our job so difficult. So if we go in and we damage something, that area is not going to heal itself. It's not going to recover. There is some plasticity. There's a little bit of redundancy in the brain tissue, but for many areas, you've got one location. If you damage that one location, then there's no recovery from that.
Coming next year, Spectrum Health Medical Group will have a new tool that will assist its surgeons. It's called an intraoperative MRI, and it's just what it sounds like. An MRI scanner that comes to the patient while they're on the operating table and gives doctors real-time images.
So this is a very, very large tumor. And this is somebody that we took to the operating room. We resected this. This was actually something I did at my previous location. We used intraoperative MRI. We were able to get all the tumor out. And this patient lived for 2.5 years. This is somebody that, you know, looking at the films, I would have expected them to live for 12 months if they were lucky.
It's not just technology that helps, it's the people. The brain and spine tumor team at Spectrum, who are hoping to move to a new facility soon, are a one-stop shop for all the information a patient needs to address their tumor and the recovery.
They don't have to come in and see Dr. A and then go home and wait 2 weeks for an appointment with Dr. B and still really not know what's going on. These patients have a lot of anxiety. There's a lot of unknown. So being able to consolidate all of those services, it really raises the level. It really meets the patient's needs.
Remember, you can watch all of our medical moments at fox17online.com.